We're back with an eye-opening today's checklist about genetic testing. It could provide critical health information, but it may not be right for everyone. NBC News medical contributor Dr. Kavita Patel here to tell us everything we need to know. Welcome to the studio.
Thank you.
You've been on for years, but this is the first time we've ever scheduled you.
Nice having you.
First time, best time. Yes.
So genetic testing, for folks who aren't familiar with it, what exactly is it and what can it tell you?
Right. So what if I told the three of you that the most important breakthrough in medicine isn't a single pill or a single shot, but it's actually the ability to know your genetic map. Think of your genetic code as the recipe book for each individual. The three of you know a lot about recipes. They're very unique. Each one of us have a different recipe book. And doing these genetic screening through a simple pinprick for blood or a saliva test with a swab can literally give you and spell check those recipes for typos, those wrong words in a book, tell you and correlate to genetic mutations. These genetic mutations can confer to a number of risks of many diseases, including cancer. So we'll focus on cancer today, but it's important to know that genetic testing can cover many diseases, including cancer, especially high-risk cancers.
And yet it's not universally recommended for everybody. How common and who should be then looking at it?
Right. So it's not universally recommended right now because we want to talk to you about your personal and family history, and that really can tell us who we should test and specifically what kind of test, and also what to do with the results. For example, if you have a personal or family history of cancers at a young age, or families with multiple of the same cancers, and especially for prostate, breast, colon, pancreas, ovarian cancers, these can be very critical. And then certainly one of the things that we talk about is a family history of cancers just broadly. And for people who don't know their family histories for different reasons, we might recommend this kind of genetic screening just so you know what to do.
Is it something your primary care doctor can do? Do you need a specialist? Is it expensive?
Yes, so true story. When I started my residency, I worked on some of these initial cancer tests because for colon cancer, for example, we didn't really have these types of screenings. Now, fast forward, in my primary care practice or even in the hospital, we can talk about these cancer screenings. So it starts there, the conversation, and we can do all the things we discussed, personal, family history, which type of test is specific for you. We can order that test and refer you to a genetic counselor who becomes an important part of the team and tells you what to do with the results and how to handle them.
Full disclosure, I did it.
So did I.
A few months ago, test came back. There's a decent chance that at some point in my life I'll get prostate cancer. Alzheimer's. I'm more inclined to get Alzheimer's than most. But if someone takes the test and it comes back positive, what should they do and what should they not do?
Right. So the most terrifying words sometimes to people are positive. I want to dispel that myth. I want you to think of, in these tests, you get three results: positive, negative, or insignificant or a variant that you don't know what to do with. When you get that positive, that doesn't mean you are going to get that cancer or that disease. It just means that you're at a higher risk. And it really does give you the knowledge and power in order to be able to tell your family. And then it also helps doctors like myself put into place what we need to do for your individual recipe book. We might screen you more frequently. We might implement diet, lifestyle changes that can actually modify your risks of cancer. And we can also tell you about surgeries and other procedures that could actually save your life and reduce that risk. But remember, positive doesn't mean you're going to get it. It just tells you about the risk you have.
Dr. Patel, thank you. Great tips.
I know. Thank you so much.
Great finally having you here.
It's knowledge is power, so I'm happy to be here to spread it.
We love that. All right. Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.